conference for us.
Could I just start by saying thank you very much to all the speakers for just preparing such excellent talks. They were fascinating, and not just because I had to listen really hard to do this reflection. But anyway, I think just 3 points I want to make. I know everyone's pretty tired at this stage, but trying to link all the speakers together was a bit of a challenge. But the 3 areas that I would link these together are around the links between environment and health that were described in different ways, research and the future. So just starting with these links, I think I'll start with Stephanie when she said that sustainability cannot be attained if we do not deal with debilitating illnesses, which was interesting as a start off to this interconnection between environment and health. But that was followed by Mike, who then gave a very positive story of 20% of the population engaging with the natural environment greater than once a week, and what that means for quality adjusted life years, or QALYs, and that could be up to 2 billion euros for the economy. But he also gave the dark side of that, and that was the unequal access to green and blue spaces, that link to hopelessness and the link to disease prevalence. But he also asked some really interesting questions, and that was, does urban living contribute or not to environmental behaviour? Does shopping equally contribute to people's health, which I thought was fascinating? But he had a great framework there, and that was health is something that's done by you, and it's related to environmental quality, whereas disease is done to you and quite often is environmentally damaging. And I thought that was a really nice framework on it, but I think it was topped by David Pension's description when it says, it's not what you do to the environment or what the environment does to us, it's what we do to each other because of the environment. And I thought that was a really nice way of putting it. And he just told us to get real, which, yeah, we probably do. On research, Jock said we needed more cross-disciplinary systemic approaches that balance precision and relevance, embrace multi-causality, longer timescales and multiple endpoints. And that is true, and I think we'd probably need a bit more than the 0.6% of the EU research budget that he described in order to do that type of research. But then, if we do the research, you have to look at what Mike said, and that was that scientific evidence was poorly put together, which hampered our approaches to government for resources, where 384 studies that they looked at only got 11 studies that yielded data. So yeah, we can still do a lot of bad research as well. Jonathan then, in terms of his talk, talked about local problems being masked by national assessments. So again, we can do a lot of national research, but still local communities feel that they're not represented within that. And he did mention a role of big data in trying to get to the local situation. But Tom Connell from Galway County Council also, it was nice to see, had a link with the Insight Institute for Data Analytics and NUIG. So there I thought was a good example of a local authority cutting through that and going straight to data analytics on it. But there were some really good questions from the floor. We've no data at a locally disaggregated level, which is hampering that. And again, good to see Galway County Council doing some stuff. And also a note of optimism that the potential of using postcodes as a tag could be a potential way forward, but it's too early to see. But Teresa pointed to some integrated data that's already there, including the HealthWell data that she did and a few more sources. On the future, David Pension said that we have to have a very positive vision for the future, which I'd agree with. And that was backed up by what Michael said, which was we really need a manifesto for the kind of environment we want from a health perspective. And it was great to see again Tom Connell and Galway County Council being, as he said himself, in the front of the front line, creating places that people want to live in, work in and visit. So there's someone that's kind of trying to grab this and trying to describe the future. And he indicated that health and well-being was one of Galway's 5 strategic actions. And I really like the fact that they have a public realm strategy, which I'd never heard of before, and I thought, that's very interesting, particularly because it's dealing with quality of life and creating better communities. And that's interesting too, because Stephanie said we're living longer, but not living longer in good health. but a lot of that care is going to happen in communities and within people's homes. So the link back to a public realm strategy where you're trying to create sustainable communities. But Tom also pointed to the challenge of getting political traction on implementing these strategies. And Martin also attested to the fact that we spend more time trying to avoid liability and blame instead of looking at the evidence of harm. So there are some uphill battles, and particularly when David Healy said that we might have to go through 17 steps from awareness of a problem to actually doing it. So an apathy, you can see, is the easier route for a lot of people. But I think Stephanie said it very well in terms of working together for the future. We need to build a network of networks, building on a long history of collaboration. And Laura indicated that transformative change is needed because we cannot do it alone. And what is clear, that collaboration will be a significant part of the future. But what do we do in that future? We have to do more than stand up and look to our left and look to our right and see what other people are doing, as was happening when the fire alarm goes off. Or to do what Teresa described, which was doing public consultation after the report was written, which I thought was a really nice one. I'm sure that minimises the amount of comments you get back. But maybe, as it was said, we need to engage with communities, with their agenda. And really at the final note I'd leave you with, that we have to ask what concerns you about barriers that prevent you from living the life that you value. So maybe I'll leave it at that point. Thank you very much.
Thank you, Darragh.